Botox, Dysport, Xeomin, and Juveau are all what we call neuromodulators. So these neuromodulators function to weaken the muscles that we inject them into, and by weakening those muscles temporarily, it improves the appearance of dynamic wrinkles. So dynamic wrinkles are the wrinkles or rhytids that are caused by muscles contracting under the skin of your face. So I can't wrinkle my forehead right now because I have Juveau injected in my forehead. If I didn't have Juveau injected in my forehead, I would be able to fire my frontalis muscle, which is the muscle underneath my forehead skin. And when that muscle contracts, it creates horizontal wrinkles on the overlying skin. By injecting a neuromodulator into that muscle, the muscle becomes unable to contract, and therefore those wrinkles cannot form. So that is what all those neuromodulators do. Botox, Dysport, Xeomin, Juveau, they're all neuromodulators that work the exact same way. They all disrupt the chain of muscle contraction where the nerve meets the muscle. So we call that the neuromuscular junction, where the motor nerves reach the muscles, and the botulism toxin at that location prevents the nerve signal from causing the muscle to contract. The results from neuromodulator injection last about 3 months, and then it wears off and you have to have it redone. The effect of the neuromodulator takes about 3 to 7 days to become apparent. So it takes 3 to 7 days after injection for the muscle to become weakened. And if you haven't had neuromodulator before, or if it's been a long time since your last treatment, it can take an additional few weeks for the wrinkles to go away after the muscle has been weakened. So one advantage to keeping up with your neuromodulator injections is that the wrinkles don't have time to reform or get as deep as when the muscles are contracting. So if I don't keep up with my neuromodulator injections and I'll go months without a treatment, the wrinkles on my forehead and my glabella and my crow's feet start to get a little bit deeper. And then when I do have a treatment, it takes about 5 to 7 days for me to have the muscles get weakened, and then it can take weeks after that before the wrinkles actually start to go away. So that's in summary what the neuromodulators do. Botox, Juveau, Dysport, Xeomin, they're all neuromodulators that function like the botulinum toxin, and they block the communication between the nerve and the muscle at that neuromuscular junction, temporarily weakening or paralyzing those muscles to improve dynamic facial wrinkles. Now, if you have static facial wrinkles, in other words, wrinkles that are not caused by muscle contraction, those need to be treated with a resurfacing laser to actually tighten up the skin and kind of sand down those wrinkles. So that is a different problem with a different solution. If you'd like to make an appointment for a neuromodulator injection with Botox, Dysport, Juveau, or Xeomin, you can do so on our website. We have a scheduling link to schedule those treatments in our office. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.